Hey everybody, I'm Jay Glazer, and most of you probably know me as the sports guy from TV and radio, but my true passion is really advocating for mental health awareness, including sharing my experience living with ADHD. I was first diagnosed with ADHD during my freshman year of college, all the way back in 1989. It was a time when many people didn't even understand what the condition was. I was constantly having to explain ADHD to my professors and peers and how it was significantly impacting me. In school, I was always that kid who needed to take breaks outside the classroom to try to regain my focus. Sitting through a 3-hour lecture or studying for extended periods of time, that was not easy for me. I remember feeling misunderstood, and I struggled with my condition. When I was first diagnosed with ADHD, I was put on a stimulant treatment. But after trying multiple options, my doctor and I realized stimulants were not the right fit for me. I continued to search to find the right medication to help manage my ADHD symptoms. After years of searching for the right ADHD treatment option for myself, I asked my doctor about a non-stimulant that I had heard about called Qelbree. Once we discussed my symptoms and previous treatment history that I had experienced in recent years as an adult, we both thought might be a good fit for me. Qelbree is a non-stimulant prescription treatment for ADHD in patients 6 years and older. Qelbree is a once-a-day, non-stimulant medication that provides rapid and extended release for a full 24 hours of medication exposure. And Qelbree can be taken any time of the day. Lucky for me, this means I could take my medication at night, which I found has worked best for my daily routine, especially since I'm usually in studio all day or bounce around to the gym. It really helps me out. Because Qelbree is a non-stimulant, it can be conveniently refilled each month without requiring a new prescription, which is perfect considering my busy schedule. I've had a positive experience with Qelbree, and I'm so thankful I talked to my doctor about it. Overall, it has helped make my ADHD symptoms manageable and led to less chaos and more control of my condition, something I had been looking to find for years. I faced many challenges because of my ADHD symptoms, and due to my short attention span, I've often had difficulty concentrating on something for more than short bursts. Being on TV and radio, it's easy for your mind to actually jump ahead. So sometimes I'm already thinking about the third segment while I'm still on the first. I always felt just so scattered. With Qelbree helping my ADHD symptoms, I feel much more confident in front of the camera when I'm conducting interviews or moving quickly from segment to segment. I feel more empowered and knowledgeable about my ADHD today than ever before throughout my 32-year career. As you can imagine, ADHD has played a significant role in my personal relationships as well. It's funny, my wife Rosie, she looked at me mid-conversation recently and said, "Wow, it's so nice to talk to you, Jay." May sound silly, but it's those moments which make my journey worth it. My experience with Qelbree has inspired me to raise awareness around this condition even further. I am a mental health advocate first, very proudly, and I want to encourage others diagnosed with ADHD to overcome the stigma and know you are not alone. Remember, ADHD does not discriminate. Anyone could be impacted by it. I know many men, including myself, have traditionally found it difficult to take their mental health seriously and talk about their ADHD. Those times have to be over. You might have heard that women are also being diagnosed with ADHD more than ever before, which further highlights the importance of raising awareness and symptom recognition. Having open conversations about ADHD helps to reduce the stigma and provides an opportunity for individuals to learn from, educate, and empower one another. And I am hopeful we will continue to normalize this sentiment as we increase awareness of this condition. The best piece of advice I could offer someone with ADHD: don't give up on yourself. Don't give up on finding the right care. I encourage you to talk to your healthcare provider like I did about whether treatment with Qelbree may be right for you. Let's all walk this walk together.
Qelbree viloxazine extended-release capsules is a prescription medicine used to treat ADHD in adults and children 6 years and older. Important safety information. Qelbree may increase suicidal thoughts and actions in children and adults with ADHD, especially within the first few months of treatment or when the dose is changed. Tell your doctor if you or your child have or if there is a family history of suicidal thoughts or actions before starting Qelbree. Monitor your or your child's moods, behaviors, thoughts, and feelings during treatment with Qelbree. Report any new or sudden changes in these symptoms right away. You should not take Qelbree if you or your child take a medicine for depression called a monoamine oxidase inhibitor, MAOI, or have stopped taking an MAOI in the past 14 days. Also, you or your child should avoid olozatran, duloxetine, ramelteon, tasmelteon, tizanidine, and theophylline. Qelbree can increase blood pressure and heart rate. Your or your child's doctor will monitor these vital signs. Qelbree may cause manic episodes in patients with bipolar disorder. Tell your doctor if you or your child show any signs of mania. Do not drive or operate heavy machinery until you know how Qelbree will affect you or your child. Qelbree may cause you or your child to feel sleepy or tired. The most common side effects of Qelbree in patients 6 to 17 years are sleepiness, not feeling hungry, feeling tired, nausea, vomiting, trouble sleeping, and irritability, and in adults, insomnia, headache, sleepiness, tiredness, nausea, decreased appetite, dry mouth, and constipation. These are not all the possible side effects of Qelbree.